The purpose of this motion analysis project is to clearly identify the biomechanical properties associated with a jump shot in basketball, as well as potential injury from this movement. The jump shot is broken down into 3 movement phases: pre-shot or preparation phase, mid-shot or movement phase, and post-shot or follow-through. The pre-shot involves preparation for the shot. The player has his knees slightly bent along with his throwing arm in preparation for the shot. The support arm is flexed and internally rotated and gently placed on the side of the ball for guidance. The throwing shoulder is concentrically flexed by the anterior deltoid and coracobrachialis for power production, and the throwing elbow is also concentrically flexed by the brachioradialis, biceps brachii, and brachialis for power production, precision, and accuracy. The throwing wrist is in concentric extension by the extensor carpi ulnaris, extensor carpi radialis longus, and extensor carpi radialis brevis, and placed under the ball for support. The hips are concentrically flexed by the iliopsoas, rectus femoris, sartorius, and pectineus for power production. The knees are in concentric flexion by the knee flexors, sartorius, gracilis, semimembranosus, and semitendinosus for power purposes, but they are also eccentrically extended by the rectus femoris, vastus lateralis, vastus medialis, and vastus intermedialis to aid in explosiveness via the stretch shorten cycle. The support arm is secondarily flexed for aiding in support of the ball. After the pre-shot, the player moves into the mid-shot or movement phase where the shot is executed. This is the phase where the player's feet have left the ground and the player's hands are releasing the ball upwards. From the preparation phase, the legs extend and push the player off of the ground while the throwing arm extends and the wrist flexes to execute the shot of the ball. The wrist goes from extension into flexion by concentrically contracting the flexor carpi radialis, palmaris longus, and flexor carpi ulnaris for power production and the shot of the ball. The elbow also goes into concentric flexion by the contraction of the triceps brachii and anconeus for the precision and power of the shot. The shoulder further concentrically flexes by the shoulder flexors to aid in extension of the arm for power production. The knee is concentrically contracted into extension via the knee extensors to explode into the jump. It is important to note that the player must gain maximal height before they release the ball, so this contraction is crucial to successful execution of the shot. The hips are concentrically extended by the semimembranosus, semitendinosus, and long head of the biceps femoris to again help the player reach maximal vertical height for power production of the shot. A secondary muscle group present is the trunk extensors and flexors to help keep the hips and knees in proper alignment for power jumping and successful shot execution. The follow-through phase involves fundamental skills to aim for optimal accuracy in the shot, including the shooting hand control, elbow alignment, release technique, arc on the ball rotation, and concentration. This phase leaves the player at risk for injury, as the focus is generally on the follow-through of the arm to properly execute the shot, but the player also needs to be mindful of landing as to not injure themselves and allow themselves to quickly return to the game post-shot. The biomechanics of the follow-through phase are very similar to the execution phase. The wrist remains concentrically flexed by the wrist flexors, the shoulder remains concentrically flexed by the shoulder flexors, and the hip remains concentrically extended by the hip extensors. The elbow is in concentric extension via the elbow extensors, but is also eccentrically flexed as to hold the arm in place and prevent hyperextension for accurate and precise follow-through, allowing the ball to make it to the basket. The knee is in eccentric flexion by the knee flexors and concentric extension by the knee extensors to allow the player to safely land without a significant amount of shock. The contractions of the knee act as a shock absorber and allow the player to land gently and regain balance and control for the next movement. The concentrically contracted hip extensors give way to a small amount of eccentric flexion upon landing, helping the power that this concentration produced at the start. Both of these joints in conjugation of their contractions aid in shock absorption to hopefully prevent injury, but this phase can still render certain pathologies. One of the most common pathologies that we see among basketball players is patellar tendinitis. As the name implies, it is an injury of the patellar tendon and the surrounding tissues, resulting in inflammation. Patellar tendinitis is a common musculoskeletal disorder that usually occurs from overuse. Pain and swelling are the most common symptoms, but with time, changes in the tendon occur, such as loss of inflammatory cells in the tendon, a tendency towards poor healing, and decreased quality and organization of collagen fibers, all of which may lead to decreased tensile strength. During jumping, the quadriceps muscles provide an explosive contraction, which extends the knee and pushes you into the air. When landing, as seen in the follow-through phase, the quadriceps muscle helps to absorb the landing forces by allowing a small amount of controlled knee bend during an extended contraction. However, with excessive overusage, this tendon becomes irritated and inflamed and can ultimately lead to the injury. This is commonly seen in basketball players through a progression of the injury where pain is the primary symptom noted. This would be deemed a compression injury of the surrounding tissues, as the primary load is compression during the landing phase, where the feet are touching the ground and the knees are in flexion. However, because of the combined eccentric and concentric contraction, the tendon is also under a significant amount of tension. These combined forces yield tendinitis in basketball players due to overuse and long-term exposure. One way to prevent and decrease injuries for basketball players is to learn the proper mechanics when it comes to lifting weights and plyometrics, as to functionally strengthen the body, specifically the lower extremity strength and stability. When it comes to playing the game, landing on the ground is crucial. Your body needs to learn to absorb that contact and be able to bend while coming down from a jump. This will put less stress on your knees and equal out the impact over your entire body rather than just through your ankles or knees. Strengthening your lower legs, including your hamstrings, quadriceps, and glute max, is just one way that can help with lowering the chance of an ACL or patellar tendon injury. A preventative screening measure, such as a preseason functional movement screen or Y-balance test, can accurately detect if players have the correct basic mechanics of high functional movements and display mobility and stability of their joints and ligaments. In this project, we were able to demonstrate our understanding of structural anatomy related to the shoulder, arms, wrist, hips, and knees, describe basic biomechanical principles of movement related to a jump shot, and determine the mechanism of injury and some preventative measures for jumper's knee or patellar tendinitis.